So my background is mental health research, specifically as part of the Suicidal Behaviour Research Lab at Glasgow University. So I've been involved in a research study that's been tracking the mental health and wellbeing of people across the UK during most of the pandemic and certainly after lockdown. But today I'm going to talk mainly about, it'll be the first kind of 6-7 weeks of lockdown, a period that we tracked people over 3 different waves of data that we took. So as part of a group of researchers and other kind of stakeholders from around the UK that include the Samaritans and other mental health organisations and universities. And specifically, I'm going to talk about a paper that we had published at the end of last year. That, as I say, kind of is a longitudinal analysis that tracked the well-being of people in the first kind of period of the lockdown. So specifically, that covered, so the lockdown was announced on the 23rd of March, and we launched our first wave of our survey on the 31st of March. And then the third wave finished around the 11th of May. And on the 13th of May, that's when some of the lockdown restrictions were starting to ease. So it really kind of covers that first kind of period of lockdown that we all experienced in kind of March, April and May. So just to give a quick overview of what the study was and you know who took part in it. So it was a nationally representative sample of adults from across the UK, and around 3,000 people took part in the first survey. And that kind of was based on kind of quotas based upon the age and gender and socioeconomic makeup of the UK. So our initial plan was to conduct, I think initially it was just 4 or 5 follow-ups. We're now on our 6th and we plan to launch the 7th at the end of this month. And generally, obviously, they were all conducted online, and we asked people questions about their mental health in the weeks and months following the COVID-19 outbreak. And we measured symptoms of depression, anxiety, suicidal thinking, loneliness, and kind of more positive mental well-being. So just as a quick overview, I mean, how did people feel at the start of the COVID-19 lockdown? We found that 1/5 of people reported experiencing at least moderate anxiety symptoms. Over a quarter reported they had moderate depressive symptoms, and around 1/12 of people reported experiencing suicidal thinking within the last week. Now, an important caveat is that we don't have pre-COVID data for this group. So we can't say definitively that these are higher than they would have been before the pandemic. But certainly when we look at other research that was conducted before, for example, a study that we conducted with young people in Scotland indicate that around 11% of people have thought about suicide within the last year. So when you really make that comparison, if it being just the last week, 1/12 does feel relatively high. So how did this change over the waves? Now, the good news in a way is that actually anxiety and depressive symptoms actually decreased or at the very least stabilised over the waves. And actually most indicators of mental health did improve. So that included people felt more positive, so general well-being actually increased over the waves as well. And I think in a way when we reflected, that kind of made sense, because at the very start of the pandemic, at the start of the lockdown, there was an acute anxiety and an acute worry that a lot of people experienced about what the impact of lockdown was going to mean for them, what it was going to mean for their jobs and their families and their health as well. And I think probably over the 6 weeks that we've measured, that probably dissipated a wee bit, and people probably got a little bit more used to the new routine and the new life that they were kind of experiencing. Now, interestingly, in contrast to that, we actually found that the suicidal thoughts increased over the waves. So from wave one, as I said, around a 12th of people, so about 8% experienced suicidal thoughts. By wave three, that was nearly 10% of people. So just to kind of give you an idea of how we actually asked that question, we asked people how often they thought about taking their life in the last week, and they were given options of either never to maybe one day, a couple of days, to nearly every day. So the measure that we created from that was either people who had no thoughts at all versus people who'd had at least one thought or more. And yeah, we found obviously that on that indicator that the suicidal thoughts did increase. So, I mean, one of the reasons we were kind of thinking about that, because we can never know for sure exactly why that increase has been found. One of the factors we considered was that there was possibly a wee bit of a lag period between that initial anxiety and the acute feeling of worry and anxiety that happened in those first few weeks of lockdown. But possibly for that to maybe end up developing into the likelihood of people thinking about suicide maybe took a little bit of time for that lag to happen. Or potentially as well that by its nature, suicidal thoughts are a kind of future orientated thing. So it may be that people, because of the developing uncertainty that people had in their lives, that maybe suicidal thinking became more of a salient option to them because it was something that was to do with the future. So we thought we'd have a wee look at how that was impacted by age and gender, because obviously it was quite a stark finding. So consistently across all of the mental health outcomes, we found that young people fared the worst overall. They reported the highest rates of depression, the highest rates of anxiety, and the lowest well-being. And it was the same with suicidal thoughts. So by wave three, 14.5% of 18 to 29-year-olds had experienced or had thoughts of suicidal ideation within the last week. And then on the flip of that, the older adults, so the people who are aged 60 plus, they fared the best mental health wise throughout all the measures as well. Which, I mean, confused us a wee bit because we thought they were actually the people that were most at risk from COVID-19. So we're not 100% sure why, but I think just the older age group just generally in other research does tend to be a little bit more protected from mental health outcomes. And then looking at gender as well, we did find that women reported higher rates of suicidal thinking, but again, that's quite consistent with other research that shows that as well. And also people from a lower socioeconomic grouping also reported higher rates of suicidal thinking. But we did find that the higher socioeconomic group, that those rates started to converge as the waves went on, and that could maybe be a reflection of people's uncertainty about job and uncertainty about their kind of livelihoods. Now we also looked at loneliness. Now levels of loneliness didn't actually change significantly over the waves for the whole sample. But we did find that with some of the age groups, there was actually a change over time. Although young people, again, experienced the highest levels of loneliness, their loneliness actually started to decrease as the pandemic went on. Whereas actually the older age group saw a little bit of an increase in loneliness. And I mean, I suppose one of the reasons for that we considered was that young people maybe adjusted a bit quicker to certain aspects of it, and certainly with using Zoom, using FaceTime, there was possibly just more opportunity, or more likely that they would adapt to that a little bit easier than the older age group. So just to conclude, I know that was a wee bit of a whirlwind there of information. So overall, we would say that the mental health and well-being of the population does seem to have been affected by that initial phase of the pandemic. In particular, young people, women, and people from a lower socioeconomic group, as well as those who actually had pre-existing mental health problems. Generally, those groups do have fared worse, especially at the start of the pandemic. Now, the positive is that actually the rates were highest at the start of lockdown, and they do seem to have improved over the waves, certainly with feelings of anxiety. But obviously, the exception there is with suicidal thinking. And it is concerning, obviously, that especially as we've noticed with young people, that the rates are quite high. But one thing I would say is it does not necessarily mean, and certainly there has been no evidence so far that that suicide rates will actually increase during the coming years or coming months, or last year. That there's no evidence yet to say that the suicide rates themselves have actually increased at all. So it's just something that we do have to monitor and keep a bit of an eye on. Okay, so that's the end of my.
Thanks so much. There's so much really interesting information. There's definitely some questions to get to